Hello friends, today we'll discuss the anti-diabetic class of drug DPP-4 inhibitors. The drugs like Sitagliptin, Vidagliptin, Sitagliptin, Linagliptin comes under this category. Let's see how the DPP-4 inhibitors work. Friends, normally whenever we eat the food, the glucose from a food coming down from the esophagus to the stomach and then to the intestine. When a glucose touches to the walls of the intestine start producing a hormone named incretins. There are two types of incretins produced by the intestine. The first one is the GLP-1. GLP-1 stands for glucagon-like peptide 1. And second incretin produced by the intestine is GIP, that is glucose-dependent insulinotropic peptide. What are the effects of these incretins, that is GLP-1 and GIP, on the blood glucose level? So friends, let's assume that this is a blood vessel and within a blood you have an ample amount of a glucose present. When GLP and GIP are produced, incretins are produced by the intestine, this GLP-1 and GIP will travel to the beta cells of the pancreas. Now, once they reaches to the beta cells of the pancreas, this will ask the pancreatic beta cells to increase the amount of insulin secretion. That means both incretins help beta cells to produce more insulin. Now, as you are aware, what is the impact of insulin on the glucose? This insulin reduces the blood glucose levels. On the other hand, the same GLP-1 and GIP, these are incretins, goes to the alpha cells of the pancreas and ask the alpha cells of the pancreas to reduce the glucagon secretion. Again, I am repeating myself, it reduces the glucagon secretion. Now, glucagon was responsible for production of glucose from the liver. Since less amount of glucagon comes out, under the influence of little glucagon, the liver produces very little amount of glucose. So, in both the cases, GLP-1 and GIP, that means incretin, has reduces the blood glucose amount. So incretins are responsible to reduce the blood glucose. So incretins are considered good for the diabetic patients. What is the role of DPP-4 or what is DPP-4? That is dipeptidyl peptidase 4 enzyme. Normally, body produces this enzyme. Which organ of the body produces this enzyme? This has been produced again by the intestine. This intestinal enzyme, which is responsible for inactivation of GLP-1 and GIP. That means the DPP-4 enzyme produced by the intestine responsible for inactivation of incretins. Since the inactivation, the incretins will become inactive. This inactive incretins will not able to reduce the blood glucose level by influencing the release of insulin and glucagon. So, once the DPP-4 inactivates the incretin, blood glucose starts rising. Unfortunately, in diabetic patients, the activity of DPP-4, that is dipeptidyl peptidase 4 enzyme, increases. So, it is responsible for rapidly inactivating the incretins, that is GLP-1 and GIP. It is very important to protect the incretins from DPP-4 effect. So, to protect the incretins, that is both the GLP-1 and GIP, we are introducing DPP-4 inhibitors, the drugs like Sitagliptin and Vidagliptin. This drugs, Sitagliptin and Vidagliptin, goes to the DPP-4 enzyme and block this enzyme. Once your enzymes are blocked by the DPP-4 inhibitors like a Sitagliptin and Vidagliptin, these enzymes will not able to block the effects of incretin. These enzymes will not able to inactivate the incretins. Incretins will survive and incretins will keep producing more insulin, keep reducing glucagon. Ultimately, the blood glucose level decreases. So this is how the Sitagliptin Vidagliptin works. Sitagliptin Vidagliptin protects the incretins, that is GLP-1 and GIP, by inhibiting the DPP-4 enzyme. So this is how it reduces the blood glucose levels. Thank you. If you like it, please share and subscribe.